Hello everyone, my name is Parmeet with SolarX, and today we're going to talk about the new changes with PEBC's competencies. So starting May 2026, the PEBC is now changing their competencies to be in line with the NAPRA 2024 competencies. Historically, the competencies were based on the 2014 blueprint, but now that is changing. In this video, we're going to discuss what those competencies are and how they're going to impact you if you're writing an exam in 2026. Previously, the PEBC built their OSCE and MCQ exam on the 9 core competencies, but now that list has shrunken down and it's been condensed into 5 core competencies. We got competency number 1, which is providing care. This competency is split into 1A and 1B. 1A is clinical care and 1B is distribution. So starting with 1A, providing clinical care. This is considered to be the core of pharmacy practice. This is where you do a lot of patient-centered clinical care and clinical strategic problem solving. This can include a variety of tasks, such as gathering patient information, assessing the patient's health status and medication needs, creating care plans or therapeutic plans, and then implementing those care plans as therapy, and then finally, monitoring and adjusting the therapy as needed by the patient. Think about it like this: assessment, decision-making, implementing your therapeutic plan, and then following up with the patient. This is what the core of MCQ and OSCEs is all about. Now we have 1B, providing care but focusing on distribution. So this competency focuses on a few things, such as processing prescriptions, compounding and preparation, technical and final checks, inventory management, as well as controlled substances and safety systems. The next competency is knowledge and expertise. This competency is not purely about memorization, it's actually about how you use the knowledge practically. In this case, PEBC can test you on evidence-based decision making. They want to see how well you can apply guidelines based on the patient scenario, whether it's for MCQ cases or OSCE cases. Here, they can also test your professional judgment, and they can also ask you why you made those specific decisions. You've heard it thousands of times. Don't just memorize questions and answers. Always be able to understand them and explain why you're making those decisions. This is pretty much what that competency is testing you on. Then we have the next competency, which is communication and collaboration. This competency is massive, especially in the OSCE exam. This can include a variety of situations such as patient counseling, shared decision-making, inter or intra-professional collaboration, documentation, and then transfer of care, just to name a couple of examples. Essentially, PEBC wants to test whether you are able to explain, document, collaborate, as well as adapt your communication skills depending on the scenario. The fourth competency is leadership and stewardship. Now don't get this wrong, this is not only about how you can be a leader or a manager in a pharmacy setting, but also it focuses on how you are going to be a healthcare professional serving the needs of a patient. This can relate to supporting your colleague, using healthcare resources responsibly, health promotion, responding to emergencies, and thinking beyond just the individual patient in front of you. A good example to think about is influenza. When we are promoting the influenza vaccine, we're not only speaking to the patient, but we're also asking them to reach out to their fellow family members and friends so they can also come into the pharmacy and get their vaccination. And then finally, we have professionalism. This competency bundles a couple of things, such as legal and regulatory requirements, ethics, equity, diversity and inclusion, patient safety, quality improvement, as well as professional boundaries and wellness. Basically, how you behave in certain situations is what they're looking at when it comes to OSCEs. For MCQ, this could be an MCQ question where they're asking you what your actions would be in certain situations. So what does this mean for students taking the exam in May 2026 and beyond? PEBC didn't necessarily make the exam easier or harder. They're simply making it more realistic. You're being tested on many things such as clinical reasoning, systems thinking, communication, ethics and safety, and professional judgment. Your studying needs to match how a pharmacist would practice in real life. For those interested in knowing how the breakdown of these competencies specifically are based on the MCQ or OSCE exam, you can pause your screen now and take a look at the graphic in front of you. If you want help aligning your prep with what PEBC expectations are, reach out to SolarX because this is exactly what we do and how we teach our students in our courses.